I'm going to demonstrate how to do an infant assessment on a newborn. So the first thing I would do, I would listen to their heart rate and their respirations while they're still asleep before bothering them. So I'd listen at the 4th to 5th intercostal space while using an infant stethoscope. And the heart rate should be around 110 to 160 beats per minute. And then I would listen for 1 full minute with the baby. Alright, and then I would count their respirations while they're still sleeping as well, so I can get an accurate amount of those. And then for the temperature, I would take their temperature under their arm, and that should be usually between 97 and 98 degrees, somewhere in there. Alright, it's 98, so that looks good. Alright, and then the blood pressure, you would use a infant blood pressure cuff to take that. And usually the RN will do that. It's usually not in the LPN's scope of practice. And then I would start head to toe, just like on an adult. I would look at their head, make sure there's no molding from the birth canal. I mean, that is normal if you find that, or any spots or bruises or anything like that. And your head looks okay. I would look at the eyes, make sure the eyes are symmetrical, spaced far enough apart. Check for the pupillary reflex. Their eyes are open. And then look at the nose, make sure the nose is okay. And look at the mouth. See those Epstein pearls in there. Make sure the tongue is symmetrical. And then look at the ears. If the ears are low set, that could indicate Down syndrome or another chromosomal abnormality. Make sure they're not traumatized in any way. And then I would look at the skin. I would check the elasticity of the skin, make sure the turgor is good. And then with the soft spot on the head, the fontanelles, I would make sure if they're depressed, that could indicate dehydration. So you want to make sure they're not sunken in or anything like that. Decreased skin turgor is also an indication of dehydration. Then you look at the chest, make sure the arms make sure they've got good range of motion in their arms. Make sure they're not struggling to breathe. If their nose they're having nostril flaring, that can be a sign of trouble breathing. Make sure there's no chest retractions. And we already listened to their heart, and just check out their skin all over their body. And then perform range of motion in legs. Make sure they don't have any hip dysplasia. And this one looks okay. And look at the cord. Make sure the cord is clean and dry. It is normal for babies to have some peeling of the skin after birth. So if you see that, that is normal finding. Then you examine the genitals, make sure the testicles are descended with a boy. Make sure the labia minora is underneath the labia majora for a girl. If it's not, that could indicate they're premature. And you just turn them over. Check their back. Make sure that anus isn't imperforate. And you listen to their bowel sounds. They should appear shortly after delivery. The bowel sounds should. They should have passed their first stool about 24 to 48 hours after birth. So, and that's another sign of gastrointestinal motility. With urinating, their first urine might have a few crystals in it, but that is normal. Yeah, make sure they're alert or not responsive, not just sitting there laying, not making a sound that could, if they're not sleeping, that could indicate a sick baby. Yeah, make sure they have no extra digits on their hands and feet. And then you want to make sure they have good reflexes. The Moro reflex is when you suddenly drop the baby, not actually drop it, but like if it would to come down suddenly, their arms and legs would like flare out like that. The rooting reflex, if you put something close to their mouth or touch their cheek, they will turn their head towards you and open their mouth like they're gonna suck. The neck reflex, and you check for that. The palmar grasp, that's they grab your hand when you put your finger in their hand. And the Babinski reflex, that's if you stroke the sole of their foot, their toes will fan out. And you'd want to weigh baby. Either you want to weigh them naked, or you would, if they have a diaper on, you would weigh the diaper separate or the blanket separate, and then subtract that. And you want to weigh them at the same time each day. And with measuring, I don't have a tape measure here, but you would want to measure around the crown of the head. And then with their chest, you want to measure at the nipple line. And then just the widest diameter. So, all right, and then that's all I've got.